onwards. So I'm just going to introduce our final speakers, Lisa Nolan and Andy Williams. Lisa is the Senior Programme Manager for Mental Health Neurodiversity at NHS Cheshire and Merseyside ICB, Liverpool Place. And Andy is the Chair of Liverpool Adult ADHD Ladders of Life. Welcome. So I'll just read out your bios. Andy has been chair of the board of directors since inception in 2010 and also assists with service delivery for education, employment and entrepreneurship. And Lisa works within the all-age mental health, learning disability and neurodiversity commissioning team as part of NHS Cheshire and Merseyside ICB. Lisa has led on children and young people's mental health and neurodiversity commissioning for 22 years and in more recent years on the adult ADHD pathway. Over to you both.
Okay, thanks. Am I clicking or are you clicking? Okay, I'll give you the nod. Hi everyone, yeah, I'm Lisa Nolan. I work for Cheshire Merseyside ICB Liverpool Place and I do lead on mental health commissioner for children and young people and also all age neurodiversity as well. And I'm joined today by Andy, who's going to talk a bit about the service that he is the chair of, Ladders of Life, which is one of the services we commission in Liverpool as well. So, next slide, please. I bet no one said that today, yeah. Next slide, please. So what I'm going to talk about is basically what we've been developing in Liverpool over the last few years, why we've been developing, what we've been developing, some of the challenges and opportunities, some of the next steps, and obviously, more importantly, the importance of needs-led community support and services, which basically is what Andy is going to touch on at the end. I am going to focus on mainly the local offer in Liverpool, but just to say that there's a lot of work going on across Cheshire and Merseyside to have a more standardised offer, really, and reduce that variation and inequalities across the system that exist at the moment. Okay, next slide. I don't really need to go into this much really because Gina touched on a lot of it before when we talked about the neurodiversity strategy that we have now in Liverpool. But I guess the key areas are why we're doing it is because there is an increase in need and we're not meeting that need currently in Liverpool. There are increasing costs to the public service with regards to unsupported neurodiversity as well, and obviously poorer outcomes and widening inequalities as well. And what we really want to do, because some of that high cost investment is currently going to non-commissioned activity across the ICB, and what we would rather do is invest that in more local services, and that's where we are moving forward. So the main aim of our neurodiversity offer is really to move to an all-age neurodiversity local offer in Liverpool, which supports our population needs. And when we talk about all age, and don't get me wrong, I get a bit touchy when we talk about all age because my main experience is working with children and young people. And often when we talk about all age, we talk about adult models that children and young people have got to live within. So I do get a bit touchy. So when we talk about all age, we need to think about those population needs at those different age groups, but also the developmental needs as well of individuals too. And we need seamless, accessible care with those clear transition pathways as well for children and young people services to adults, which are really supported. We really need to move to more holistic care as well, move away from the diagnostic, the emphasis on diagnosis, but to more needs-led support and that wider offer of support that people need as well, children and young people, adults, older people, and families and carers as well. And we really do need to support that whole family approach when thinking about this. And we really need to think it's not just a health issue, because it's not, and we think we've touched on that today. It's a whole system issue. And so it's not just about health commissioning either. It's about wider commissioning responsibilities across the city as well, to take ownership of this. And it's really good now that we have that joined up neurodiversity strategy that everybody is signed up to and moving towards. We want to improve access to support at the earliest of stages as well. based again on need and not just a diagnosis. And those pathways need to be joined up. So I don't know how many of you are here this morning, but a colleague from Alder Hay and Advanced Solutions, as I see Claire is still here, talked about the children and young people's neurodiversity pathway and the more joined up approach they're taking with regards to those pathways through assessment and diagnosis and that wider support offer as well, because that is far more advanced in children's than adults, and I'll get onto that in a minute. We need to use our resources more effectively as well, and that's not just funding, but that's about the workforce as well. We need to really build capacity, understanding and learning in our workforce as well. And I think we've heard a lot about that today, that, you know, learning and knowledge and real understanding and listening to the needs of our population. And also align some programmes of work as well. And we've just heard about mental health then. And, you know, there are certain programmes of work and in commissioning, certain programmes of work usually come with pots of funding. And those pots of funding are for those programmes of work. What we need to do better is align those programmes of work. So in mental health, we've got things in, you know, we've got schools facing services. So we've got mental health support teams in schools now, but we've also got the special educational needs agenda. We've also got a lot of programmes around neurodiversity as well. We need to join them up a bit more and learn from each other and provide that more holistic offer around those needs. And all of this that we're doing does align with some of the National Task Force report that's obviously just recently been published as well. So it looks, that takes that more holistic view, and it talks about taking that more holistic view and joining things a lot more. So what are we doing? I'm not going to really go into this slide because I said before, as I just said, Lindsay was here and Claire before just talked about the children and young people's local offer, and there has been a significant amount of work going on in Liverpool on CYP neurodiversity for a good number of years really, and it's informed a lot of the Cheshire and Mersey discussions that we're having at the moment. It's all co-produced and co-productions sit at the heart of everything that we do. And developments to date have focused on that holistic pathway from that early help to assessment, diagnosis, that ongoing support as well, but that wraparound ongoing support throughout that process. And it's obviously provided as well through an integrated approach and partnership approach through NHS provision, local authority provision, and also the third sector as well. And Claire's is today from Advanced Solutions, and they talked about that before. There's some additional work happening to further develop this pathway. And you'll see the Know Me profile tool in red there, and that is because that's a piece of work that's in development. And I know Lindsay talked about that before. And that really, the aim of that is so young children, young people and their families can access the right support at the earliest of stages at the right time as well. And we do know, and just to emphasise, we do know there are still a lot of challenges with assessments, waiting times for assessments and diagnosis currently. But again, working really hard with our providers, and our providers are working really hard to try and manage that as well. The adult pathway is a bit different to children's, and it's not as advanced, but we are doing some really good work locally around it. There are two current separate pathways commissioned with two current different providers. So our autism provider is Merseycare, and our provider for ADHD around assessment and diagnosis is Cheshire Whittle Partnership Trust over the water, supported through Ladders of Life as well. But there's obviously a third pathway, which is obviously independent provision, and that can be accessed privately or obviously through the right to choose pathway at the moment. As I said, our long-term aim is to move to an adult ND pathway, so that it's just one sort of single point of referral. It looks at joined up pathways, it looks at co-occurring conditions as well. Just to say, I don't like the word comorbidity either. Thanks, Sand. I'm going to touch on the adult ADHD local offer. I'm not going to talk about the autism local offer through Merseycare. I'm going to focus on the ADHD because that's the one I've been part of and been leading in Liverpool. It's still in development, but what we're trying to do is move towards a more community-based primary care model, which focuses more on need than diagnosis. And so it takes the emphasis away from needs and secondary care provision and secondary care referrals. It's based, what we've done is we started a pilot in Liverpool in enhancing the capacity in our primary care colleagues, in undertaking training for them to undertake assessments and ongoing reviews for individuals with ADHD. And this was known as the LEAP pilot in Liverpool, which stands for Leading Excellence in ADHD in Primary Care. And I had to Google that last night because I couldn't remember. And we learned from Wirral, because Wirral did LEAP a good few years ago, and they've been delivering that pilot for a long time. However, through Cheshire and Merseyside discussions and more joined up work across the system and across the footprint, we're enhancing that now even further. And Liverpool has been put in a really good place to enhance that offer following these discussions because of the LEAP pilot. And the offer will take that needs-based approach, and there's a new need stratification tool that's being designed that will be used to understand people's needs a bit better at the earliest of stages at the front door. And that front door will be primary care, which it is now. But in primary care, you will then be triaged and assessed through a new role called a neurodevelopmental practitioner. So all primary care networks will have a new role, neurodevelopmental practitioner, and our GPs and advanced practitioners will also continue to be trained to undertake assessments and reviews. So instead of waiting to be referred to a secondary care provider, and believe me, the waits are quite long, and our current secondary care provider, Cheshire Wirral Partnership, is actually closed to new referrals currently. So we've put all this investment now into primary care so that people can access services in their community, closer to home, and more quickly as well. There will be some digital resources that are developed. We do have some on the Candid website, the Cheshire and Wirral Partnership website at the moment. And obviously we will be looking at enhancing more community-based support, specifically the work that Andy will talk about in a minute as well. We are also strengthening the transition pathways between older hay and young adults and young people who presenting with less complex presentations around ADHD, who have been assessed and diagnosed in older hay, can now be transitioned to primary care for ongoing review as well. And we're going to have a bit more oversight on the right to choose provision as well moving forward, so that we can have that bit of quality assurance over those providers as well. And so only those individuals who are presenting with more complex ADHD presentations will need to move to secondary care. So we're hoping that the majority of people can be seen quicker and get access to early help support through primary care and through Ladders of Life as well. I don't know where my partner in crime has gone, but however, this has been a long journey, and it's a developing journey, and you know it's been a good journey, and it has taken a real system approach to get to where we are at the moment. And just to say, where we are at the moment is that 8 out of our primary care networks have trained GPs and advanced practitioners already in place, and are started to see individuals in primary care now as well. So it's been really really positive. There are obviously challenges along the way, as we know. Finance is a big challenge from a commissioning perspective. It's really important for us to obviously keep abreast of that. Medication shortages, and I think Lindsay touched on that before, around the children and young people's pathways, same and adults, same all over. And obviously increasing demand versus the resources currently available. However, we do have to look for opportunities in this as well. And those opportunities really do come from system thinking, ownership, and ownership around commissioning as well across the system. Looking at these new models and the way they work, and evaluating them as well to see how effective they are, and working with the people with lived experience. We've heard a number of stories today, and I feel quite privileged to have heard those stories as well today. Some of them are quite inspirational. Building understanding and capacity across the system as well around neurodiversity, research and evaluation is really important to see what's working and to sort of gather that evidence base around what we need to do moving forward. And also, you know, what's coming out nationally as well. Are there any opportunities coming out nationally? We've got the task force report, we've got reviews going on currently. We've just had the schools white paper as well, and the SEND reforms as well. So we need to think about them. And then just to say from me, really, with regards to next steps, we are piloting the Know Me profiling tool this spring, summer, and we are looking for some shared care opportunities as well with our primary care. So again, if you're a child or young person with a family, you don't always have to go to secondary care to get your ongoing reviews and prescribe. And we're looking at that to happen in primary care. And from an adult ADHD perspective, obviously, we will be continuing enhancing the offer, as I've just spoken about now. I thought you'd gone off on me then. I've finished. I'm gonna. The what? Hoped. Andy, over to you. So Andy's going to talk about one of our services that we commission, Ladders of Life in Liverpool, and the great work that they do as well.
Thanks, Lisa. Do we need the microphone for? Just talk. Okay, great. That's nice and clear. Listen, don't worry, everyone. I don't care what anyone says. I still enjoyed that Thai green curry, so it's okay. It's all right. Didn't agree with me there for a second. So I'm just gonna. People know me, but we're relieved. I've only got 3 slides. So Gina's taking a deep breath there already, so it's okay. Okay. So let's crack on then. Okay. Make sure Leona's giving me the eyes already. Okay. So I'm chair of Liverpool Adult ADHD Ladders of Life, and we are a small social enterprise, small but powerful social enterprise who do psychosocial support for adults with ADHD. That's a big word for after lunch in a psychosocial. So what we mean by psychosocial is obviously we look at someone's psychological state, the mind, the behavior, the emotions, and that interaction with their social environment, which can mean obviously their relationships, their culture, their communities, and we try and make sense of that. Now, Ladders has been a social enterprise since 2010. But actually, the work actually started in 2001 when one of our founder directors, started to run a support group for adults with children who had ADHD and autism, because she found that there were no services. So adults, and then she soon realised, and the team soon realised that, hang on, some of the adults have got some of the same symptoms and problems and of the children. Maybe the best way to have the most impact would be to try and help the adults, who then could cascade learning, could cascade modes of behaviour, and as the main decision makers in families, try and have the biggest impact. So we've got a needs-led approach, and it's founded on 2 things really: nothing fancy, personalisation, actually trying to build a close relationship with someone, do something revolutionary, actually spend time really listening to them. Anytime you spend really listening to someone with a neurodivergent condition who needs help, always pays dividends moving forward. Secondly, co-produce. There's another fantastic thing we've come across. You know, if you involve people in stuff, they understand, you know. It's really weird. You know, you actually give them the time to think about stuff and say, okay, what works for you? How can we perhaps make it work better? What are your thoughts on this? What are your thoughts on that? And really listen to people and get them involved in producing their own solutions. Funny enough, sometimes some of those solutions stick. Thank you very much. Cheers. Okay, but we need a context for this. So these are the reasons why people or service users say to us, this is why we need help. So difficulties in daily life. Okay, big one. Lack of general understanding. Huge one, cuts across everything. Previous poor experiences in education. Like Jenna was saying earlier on, oh, they're the stupid one, put them at the back of the class, or you can't learn this, or why can't you understand like everyone else can understand? And then the same with employment, difficulties in, you know, gaining employment, holding on to employment, maybe understanding about the language of work. I thought Chris did an excellent explanation of the problems in the workplace earlier on. That they're the sort of things that we see and hear all the time. And then the other big plank is the sort of lack of being able to access effective treatment. It's getting better through the work of people like Lisa and the team and everything else. We're trying to enmesh our approaches so that we're not duplicating unnecessarily. We're not creating a crowded marketplace. We're not making it too difficult for people to navigate their way through to something. And don't get me wrong, you know, we don't live in Hollywood, unfortunately. these things take time. Sometimes it can be one step forward and two steps back, and then we have to have a rethink and we have to move it forward. But we're serious about what we're trying to do. Second bit is the inability to manage relationships, family, friends, in education, with employers, trying to keep yourself in a job, trying to work with work colleagues who don't understand why. Andy in the corner is always likes the window open, even though it's -10 outside, or never cleans his cups, or doesn't bring any milk in, all this kind of stuff. Okay, there might be other reasons for that as well, but never mind. But those sort of things. And then social interaction, our number one thing at Ladders, the number one thing that we can't do without, our sine qua non or whatever, our essential component is that we've got to reduce people's social isolation. If people don't come to see us, if people don't take part in what we do, if people don't feel value to do so, then we've got no foundation to build anything else on. I mean, literally no foundation. And that leads on to what people then struggle with, interacting with public services, interacting in terms of, I mean, I thought Chris made an excellent point about that sort of general advocacy support, but you've got to be careful of the double empathy problem as well. You've got to give people the confidence and the foundation to empower themselves in lots of ways. And that can be difficult because people can have many, many years of entrenched feelings of anxiety or depression or dealing with other comorbidities. It's a difficult thing to break, but you've got to do it. And just a couple of examples, since COVID, we've done a lot sort of work with landlords and housing, trying to have that, trying to take some of the tension out of some of these relationships, trying to say to landlords or people who housing associations, well, we just maybe had this sort of approach. You could have what you term a problem tenant become just a normal tenant, someone you don't hear from, you don't need to hear from, because we've adapted our approach. Let us help you, let us mediate, let's talk about it. And another one that we've had a problem with since COVID is sort of debt. And people find it difficult to deal with debt, managing debt and talking about debt, because there's still a huge social stigma, as we know, talking about mental health of any kind. It's getting better, and it is definitely changing, but people, the cycle of saying, oh, you're in debt because you're crazy, or you're in debt because you can't do anything, or you're in debt because you're stupid. No, we try and sort of break through that. Okay, so they're the sort of problems why people come with us and why we seek help, and that's why we listen to them. And then this is what we do on the back of it. I mean, it's all right, isn't it? Yeah, it's working all right, getting there. Okay, so we're a needs-led service. There's no point in turning up and saying, okay, this is what we're teaching today, if no one's interested. Because that's just absolutely no problem. Jenna, you wouldn't get many lectures, wouldn't get much interest in your lectures if no one was interested, but you're there talking about things that people want to hear or wants to learn about. So we've taken all that and we've looked at it in 3 blocks, and we've gone understanding and learning. Let people understand and learn about their condition and the core symptoms. Give people a foundation to make that discussion, to enter into those kind of conversations that are going to be constructive. Secondly, we look at that effective managing and coping strategies and techniques. What will work with you? These are some of the things that we work with other people. Try these, try this. Okay, let's see if we can make that a bit easier for you. Let's see if we can adapt it to your particular circumstances. Okay, what do you think? You come involved. You give us some ideas as well about how your personal circumstances match these things. And then the other thing as well is that health and well-being is important. Try and get people out to exercise. Try and get people to socialise. Try and get people to be involved in something that doesn't feel like a huge weight is on their shoulders because it's just their ADHD. No, there can be positive things about ADHD as well. Hyper-focusing, that ability to, be part of a group. That ability when you get that confidence to sort of move things on quickly. Some of the best employees you'll ever meet are people with ADHD because they've got a focus, they've got an energy, they've got an understanding. And then because it is needs led and because we do live in the real world, we'll help people who are diagnosed or undiagnosed. If someone presents with core symptoms and needs help, then we'll help them because it's not their fault that no one's diagnosed in Liverpool at this moment in time. It's not their fault that the waiting list is like one of those really fuzzy logic questions where, is it really a waiting list if nobody ever moves off it or it doesn't go anywhere? Think about that. Not really a list, is it? If no one's actually moving anywhere. And then managing and coping is our second one. So relationships, family, friends. Can you reconnect with that brother you fell out with years ago because he doesn't really understand you? But can we try and broker some kind of support? Because everyone needs a support network. Ladders, we're not the ambulance service. We're not the SAS. We're not going to drop every. We need to build resilience. We need to build support. We need to build understanding. So relationships with family, friends, work colleagues, education, all those sort of things that we'd expect probably everyone in this room has experienced. And then the other thing then as well is that public services. Okay, so let's try and have a different conversation with your GP. Let's try and have a different conversation with, and some GPs are better than others. Let's have a different conversation with your landlord or where your child goes to school so you can adapt to those sort of things. And then our last sort of plank is working and achieving. And I don't just mean working in terms of employment. I'm talking about working on the things that we're trying to do. It's a cumulative approach. Like I said, sometimes things go well and sometimes you've got to take a couple of steps back and look at it and reappraise it. But ADHD is a lifespan condition, so we need a lifespan response to it. So, you know, we can't expect everything to always be fantastic, but ladders will be there to help you, but you've got to help yourself as well. Okay, so we're talking about making education and employment accessible, inclusive. We run programs specifically targeted towards that goal. We look at things, award-winning programs. I'm proud to say, nothing to do with me. Obviously, the staff are better than that. But and we try and again, one of the things I think which is most gratifying with education, especially in employment and everything else, like nobody wants to be an astronaut on Friday. I haven't spoke to us about it on Monday. Everyone we speak to just wants a normal job with a normal life, however they define it. Nobody wants to become the next .com billionaire in 2 weeks' time. People just want to be part of society in a normal way. And then the other thing as well, and the final thing is that I'll put further training there and interests. Having a social life is important. It can't just all be about this heavy, emotional heavy lifting all the time. It's got to be something that you value. Your life is as important as everybody else's, and nothing else matters beyond that. And then I wrote this arrow from Lisa, one of Lisa's slides, so I thought you like it. National Institute for Clinical Excellence. Nice. NG 87. Sounds good, that doesn't it? So that's the national guideline for ADHD. And what that stresses, and what our services are fully compliant with, is it stresses a complementarity. Yeah, you might run out of ink if you write that one down. It's a big word, that complementarity between clinical interventions and then interventions that are focused upon the wider determinants of health and quality of life. And we try and balance those two. So not everyone who comes to us who's diagnosed on medication, not everyone who comes to us undiagnosed after having support necessarily wants to pursue a diagnosis. Everyone comes at a different place. And again, people change their mind and change back again. But we try and have a complementarity. So you just taking your methylphenidate off the doctor, that means nothing if the rest of the part of your life is not going anywhere. So we want about quality of life. We want people to enjoy education, employment, family life, social life. Without that, our service would not need to exist. So that's Ladders. Thank you very much for listening. That wasn't bad for me, that was it? 5 minutes. Yes. Thank you.
Stay around. I think we've got a few minutes for questions. If anyone's got any questions for Andy and Lisa. Yeah, we've got one question here and one there.
Hiya. It's not so much a question, really. Basically, well, I was diagnosed about 18 months ago, and then I had a breakdown afterwards. And one of the first places I found out about was Ladders. And I went to Ladders, and I just want to say they're absolutely amazing. I couldn't work for about a good few months. They got me back into work and just really helped me mentally, with the family, with work, with everything. You know, they saved my life basically. So I just wanted to thank you. Yeah. Teresa and Shirley, all the team. Yeah, amazing. Yeah.
No, it's not about anyone else. So
Yeah.
Thanks.
Yeah, thank you.
Thank you. Cheers.
Hi, this is for Lisa. You spoke about moving towards a sort of less diagnosis model. How's that going to affect some of our students who apply for things like disabled students allowance, who need a diagnosis to be able to access it?
I don't know for 1 minute mean that, is this on? Yeah. That we were going to stop diagnosing people on assessment. We just need to move to a more needs-led model so that the needs of someone just doesn't rely on assessments and diagnosis as well. I think you heard before from one of the lived experience panels that, you know, people getting assessed and diagnosed, and then so what? So what we're trying to do is put more of the wraparound support around and that earlier help really, and the early access to help as well. So for no reason, we're not going to stop assessing and diagnosing. What we're going to do is put that assessment and diagnosis into more community-based provision like primary care as well. So hopefully it's easier to access.
Thank you so much. I think we are out of time.